Hello again, this is Dr. James Johnson of the Orange Coast Laser Vision Center. I have another interview with a gentleman I've come to know quite well. This is Bill from Pennsylvania. Bill has a bit of an unusual story in the sense that he has had some previous treatments for his vitreous floaters.
I had the significant onset of floaters in early 2008. I've always had a small amount of floaters in my eyes over the years, but apparently in conjunction with a vitreal detachment in probably January of 2008, I had some onset of floaters in my right eye, which became very much distracting to me. And I went to talk about this with my local specialists, my optometrist, as well as a retinal specialist, to try to understand what was going on. And they indicated that this was merely the development of floaters. It was a benign condition, nothing really to worry about. But I wasn't quite satisfied with that because there was some impact to the quality of my life, certainly a lot of distractions in my vision. And I had done some research going to different websites and was able to identify a couple of doctors on the East Coast who offered treatment for floaters, and subsequently got in touch with one that was closer to me and went in for an evaluation, and we then proceeded to go through the laser treatment on both of my eyes. Okay. Unfortunately, I didn't get quite the result that I had expected. Frankly, I think I ended up with circumstances which were even less acceptable to me.
So we'll return back to, you had mentioned that after treatment that you felt that things at least were not better and maybe even diminished in some ways, or made worse in some ways.
That's correct. And just to add, before I had gone to see the first specialist, I had gone back to consult with the local specialist, and they had expressed those concerns. So basically it was, if you want to proceed, you can do so really on your own choosing,
your own risk, right?
But I did not have their full endorsement, right, per se. Yeah. But after the treatment with the first doctor, I simply ended up with essentially more floaters in more of a fixed pattern that became very difficult to live with. And again, the quality of life was being significantly affected, and I again decided on my own that I needed to do more research and see if I could find a more complete solution. That led me to a different doctor on the East Coast, and I went through a couple of sessions with him, actually 3 or 4 sessions on 2 separate visits, all on my right eye. And while he was able to take apart the structure that I saw from the first doctor, I ended up subsequently with some loops and strands, which unfortunately the end point would sit in the middle of my vision. So I was in some despair at that time because the situation was certainly not of my liking, and it was definitely affecting my quality of my life, my ability to work and read.
Worse. So you went to doctor number 2.
Yes.
Got some improvement?
Yes. I got some improvement from the original set of conditions, but I ended up with loops or strands that
changed the configuration, change the dynamics.
Yes, and it created a different kind of a problem. And after a couple of sessions with that doctor, who certainly had skills in that area, but I wasn't quite satisfied with the approach because I thought the treatments tended to be short. a limited number of shots done in bursts, which may have pushed some of the problems off to the periphery only to pop out later. But it was about at that time that I and my daughter, who lives close to you here in California, had started to become aware of your website, and you and I had an initial conversation.
I remember that conversation. It was about a half an hour or so.
Yes.
And we talked and discussed and
Right.
philosophized a bit about it.
Right, and I think you gave me your perspective of the condition, what kinds of options I had, and told me a little bit more about your treatment philosophy, the time and attention that you provide on an individual basis to work methodically through the issues that are there. And we decided that this made sense for me to see if I could get satisfaction and some resolution to this by coming out to see yourself. So I had come out here about 11 weeks ago, and in the course of that week we worked on both eyes, and I think we had 5 sessions each on each eye, and much to my surprise and satisfaction, the time I would spend with you on the laser could go from 45 minutes to, I think we went over an hour in one case, which was surprising because the other treatment philosophies were you'd get 10 or 15 minutes and then we'd see you the next day.
And so what you've just done is you revealed my secret. You're revealing my proprietary secrets, which is really it's how I approach it. I think I'm very meticulous, and I will keep going after it
Right.
until we find what we're trying to find. So after that first series, we made some headway.
Definitely. As I'd said to my family, I thought the improvement was probably 85%, 85 to 90% from the original conditions. I was really quite happy.
Good.
I went home, as I told my daughter and my wife, I went home able to see better than I had in a year. So I felt pretty good about that. So we came out this week and really went back at it at both eyes. And I think what I've experienced again, which I think is important for others to know, it's that same meticulous personal treatment. Lots of time together describing and talking about the position of things and how they move, and a fair amount of time actually on the laser, just methodically picking away at it, careful shot by careful shot.
Right, and in fact, yesterday, you were actually here physically in this office for almost 3 hours.
3 hours.
Yeah, now not all of that was laser time.
Right.
We had a little trouble dilating, had to work on the dilation and all that. But a lot of that was, sitting at the laser. And
Yes.
again, there's one particular floater that we were going after.
Right.
And it's out in the periphery, and it would kind of move. And when I typically schedule my patients, I will block off large amounts of time to allow for that. And fortunately, we were able to do that. And I think that, again, helps kind of describe how the experience is a little bit different, or I will sometimes ask myself, what am I doing different?
Right.
Am I doing something better? Am I doing something radically different? I don't know. But you, having gone to 2 other doctors and then myself, and yours is unusual because you've required so many more patients so many more treatments than typical. That is not the typical experience. And it has been a real trial and tribulation for you. It's been expensive. You've had travel. It's been really quite something.
Right.
And you have that stick to itiveness attitude. But if when all is said and done, I think we're done with our treatments. Thank goodness. Where are you now, sitting here with as you assessed it this morning, compared to
When I came in.
when you first came in?
Yeah. Significant improvement. The checklist of the major floaters that I came in with, all of those are gone. All of the big structures are gone, and really I think I'm back up where I had been before with something that's probably 85–90% improvement.
Okay. What message would you like to tell them?
Well, I think it's likely that they will experience the conventional wisdom that the floaters are benign. Learn to live with it. It's not a problem. The good news is that your retina looks fine. But if you're like me, and I think many people are, this is not something that's easy to live with. And I think if people do their research and consider what options they have, that coming to you and having a consultation and talk about it and what progress you think you can make with them is definitely, you know, time well spent. Because for me, and I think for many others, the option of doing nothing is simply not acceptable. It had and would have had too much effect on the quality of my life.